Please start, Bilal.
Good evening, everyone. This is Bilal Shishka representing marketing team at Central Pharmaceuticals. Before we start, I just hope that everyone with their respective families are safe and sound. And I'm sure we will surpass these hard times together like we always do. Once again, welcoming you all for this wonderful initiative to share knowledge. We welcome here the most valuable medical fraternity present with us tonight for our program. And we thank you wholeheartedly to show your gracious presence. This program is one of its kind coming from Central Pharmaceuticals, and definitely we will see more such events in our near future. Tonight, there shall be a fruitful insight of one of the latest emerging topic, that is mind, body, medicines, and interconnection. So, not taking much time, I am handing over the session with the privilege to introduce one of the most prominent and well-established face in Indian medical fraternity in psychiatric therapy, Dr. Madhumita Bahali. Dr. Madhumita ma'am is having rich experience of more than 33 years service in Maharashtra State Health Department and service at Regional Mental Health Pune. Moreover, Dr. Madhumita ma'am is actively involved in education, counseling, and training of medical officers and currently holding the position of Pune Psychiatric Association. I welcome you, ma'am. Over to you.
Yeah. Thank you. Thank you for those kind words in introduction. I welcome you all, friends, to the 5th Public Awareness on Mental Health program of Pune Psychiatric Association and the IPS Pune branch. So a very warm welcome. By PPA on the emerging perhaps sub-branch of psychiatry, the mind and body medicine. It is necessary for mind to be healthy if we want to achieve a healthy body. The body achieves whatever the mind will aspire. We all know this connection. Mind and body can be the best of buddies, and they can uplift each other and in miraculous ways and achieve the impossible. But the vice versa can also happen if they do not work synchronously together. The relation between mind and body is intimate, it is interesting, and it is intricate also. They both are highly influential on each other. But if we learn to make them work in synchrony, in symphony, then our whole life and our life's experiences will also turn into a melodious symphony itself. So let us know the science behind this mind and body magic. To introduce us to this emerging science of mind and body medicine, we are pleased to have with us a senior psychiatrist and highly experienced colleague of Pune, Dr. Sanjay Phadke, who is the chairperson of the IPS Task Force for Medicine and Mind and Body Medicine. And we have Dr. Nischol Raval and Dr. Kalpana Raval, who are the convener and member of the IPS Task Force for Mind and Body Medicine. And to chair this session, we are extremely happy to have Dr. Arun Marwade sir, a very highly respected and established senior psychiatrist from Aurangabad. He is the main force to bring the mind and body medicine in the scenario of psychiatry. He proposed that a task force should come into action in the IPS body for mind and body. And he is the guiding torch for all the members who are in the task force of this mind and body medicine. Dr. Marwade sir is the incoming president of the West Zone of IPS. He is basically belongs to Latur and has schooled there. And he has done his DNB from the Delhi board in substance abuse and geriatrics. Currently, he is the professor and head of the department at the MGM Medical College, Aurangabad. He delivered his talk, which was the first, I think, on mind and body medicine at the 72 Annual National Conference of Indian Psychiatry Society in Calcutta in 2020. He published a paper titled Rapidly Developing and Self-Limiting Eosinophilia Associated with Clozapine, and another paper also, which showed the psychiatric morbidity in end-stage renal disease patients. Sir is a very active member of the Indian Medical Association and the Indian Psychiatric Society and the Indian Association of Private Psychiatry. I welcome Dr. Marwai sir. Thank you for accepting the chair for this very important session, and the topic which needs to be introduced to one and all. Thank you, sir. And I now hand over the reins of the program to you. Thank you.
Thank you, Madhumita Madam. At the outset, I thank the office bearers of Pune Psychiatric Association, Dr. Madhumita Bahale, President, and Dr. Mahamuni, the Secretary of PPA. So also I thank the office bearers of IPS Pune, Dr. Jyoti, President, and Bhalchal Kalmek, the Secretary. I also thank the Mind Body Medicine Task Force Chairperson and other members. To begin, it is said by a Roman poet, Juvenal, that mens sana in corpore sano, meaning you should have to pray for a healthy mind in healthy body. This, in my opinion, may not be true, because healthy body may have ill minds or weak minds, and vice versa is also true. That is, healthy mind can be there in a weak or thin person, but definitely mind matters, because distressed mind can result in various physical disorders that we have learned in psychosomatic medicine. That way, mind body medicine is not a very new concept. As students, we have learned about the psychobiosocial model of causation of psychiatric illnesses, which includes mind as well as body. In addition to that, the social, societal, or social factors also. So Harvard University was the first to introduce this concept for managing patients in a better way. And I'm very glad that in India, this concept for the first time was introduced by Dr. Sanjay Phadke along with his team, which includes me, Dr. Nischol Raval, Dr. Kalpana Raval, Vani Kulayali, Shivrama Varambali, and Dr. Mogle. So he actually helped me in starting this task force, and since last 2 years it is there. This is the third year, and a lot many programs are done at national, international, as well as local level, trying to actually he has already introduced but established this concept to psychiatrists as well as all other specialties. Actually, it is not in itself a way of treatment. Rather, it's an integrated approach. It's an approach to deal with the patients. They may have physical illness, they may have mental illness, and a teamwork is needed. Not only doctors, some other people like psychologists, counselors, or even physical health instructors, yoga instructors, all they can contribute to good health of people. As Bahale madam used very kind words for me, she said that I will be incoming president. So with the help of Mind Body Medicine Task Force, I'm happy that they have taken the responsibility to help me in this regard. That I mean, to take more and more programs to educate population as well as medical students, so also the faculty in this regard, to use this new approach, which they will be elaborating, very soon. The first speaker is Dr. Sanjay Phadke. Actually, he doesn't need any introduction, but just for the formality, completing formality, uh, he has actually passed his DPM from Bangalore, MD from Pune, BJ Medical College. He is senior consultant in neuropsychiatry, and he is attached to Jahangir Dinanath Mangeshkar Hospital, and he has his own clinic in uh, this one, Pune itself. Then his major achievements are almost he has been principal investigator for almost 50 international clinical trials, particularly phase 2 and phase 3. He is Indo-German collaborator in neuroscience for yoga since 2007. He is invited speaker in official designation from Government of India uh, in the first international conference on yoga at New York in 2018. I think these words are sufficient to know your speaker. So I request him to take over. Thank you.
Thank you, Marwale sir, for your very generous. Marwale sir is always very generous with my introduction. So, and thanks to Bahale madam and team and all of you to have organized this wonderful program for public education. Can I request Nischol to have quickly my...
Yes, sir.
Okay, so I'm going to be really very short and crisp because it is mainly Dr. Nischol and Dr. Kalpana who are going to present larger part of this presentation. So I'm going to very quickly roll through some of my slides. Okay. And Marwale sir has already given you a good hint as to in his presidency, you can really look forward to a lot of activity coming in. So let me start with this. We all know that we are in the midst of a very challenging health scenario. And what we really need at this point of time are smart interventions, which are more personalized, giving better outcomes, which have a more focus on the quality of life, enhancing the quality of life of patients, and very importantly, which are scalable. Scalable means through which we can reach more and more people. And of course, people themselves, the patients, relatives, they are very interested to participate more in their own health matters. So they no longer, as we know, they want to be passive recipients of healthcare, but they want also to be equal shareholders, so to speak, in creation of their own health. So they like to be involved. This is what we know from surveys worldwide, that patients and families, they are very happy when they are involved more in their own treatments. And in all these perspectives, as a smart solution, something which is scalable, something which is based on a new emerging science, this mind body medicine is a very attractive candidate. Next one, please. As you may perhaps know, and as Marwade sir said, that it has its root, this particular term, although we know that psychosomatic medicine is a concept, the mind-body connection, which we have known well for a century, I mean, in a scientific way. And Harvard is often credited, with cardiology people in Harvard, they are often credited to coin this term mind-body medicine, and it has been around nearly for 5 decades. You may also perhaps know that initially it started as a intervention, evidence-based intervention, and in which people made use of techniques derived essentially from psychology and mind-body practices like yoga and meditation. And the purpose was to attain a better self-regulation, and which was integrated with medical treatments. So pharmacotherapy on one hand and the mind-body interventions on the other hand made together a good package for a better outcomes. And initially it was tried out on the cardiology patients. Later, of course, as Nischol and Kalpana will show you, there is a whole long list. Practically every disorder, whether it's psychiatric disorder or any other physical disorder in which there is a good enough evidence which has subsequently been generated about the effectiveness of mind-body medicine. But that aside, in recent times, and it is supported by fascinating research, Nischol and Kalpana are going to show you actually glimpses of this research, large part of which is neuroscience research as well as the psychoneuroimmune endocrinology research. So courtesy this new research, mind-body medicine, it is evolving as a scientifically very well grounded treatment philosophy, not just as a treatment, not just as an intervention, but whole approach to help patients. And an integrative framework which is bringing various specialties together. That is another unique part of it, because as you know, in the history of medicine, that as the specialties formed and subsequently super specialties formed, they started going away from each other. And from a patient perspective, there is often a complaint, and very often there is a good genuineness in it, that instead of looking the patient being looked at as a whole, as an entity who is suffering, the specialists tend to look at very small siloed parts of it. So the idea in mind-body medicine is to make use of the evolving science, have a very scientifically well-grounded treatment philosophy, which Nischol and Kalpana are going to tell you more about, and as well as providing this integrative framework in which the specialties again can come together. So psychiatry comes together with cardiology, psychiatry comes together with diabetes, psychiatry comes together with gastroenterology, and so on and so forth. So people have the real benefit in terms of enhanced care. Next one, please. Let me tell you some quick milestones. Marwale sir was very generous to say that we were instrumental in bringing it. It's really actually the effort of many people. I want to thank them. Sanjay, Phadke, Shivramvi and Nischol Raval, three of us are chair, co-chair and coordinator respectively, convener respectively, but there are many other people who are connected nationally and internationally with this activity. So one of the important activities of the task force was we held an international symposium in Munich, which was on health promotion. And it was blessed actually by Professor Norman Sartorius. I think everybody knows him very well in the global scenario. He is the former director of World Health Organization and a very influential, you can say, advocate and a person in the entire medical field. So he was the main person, the keynote speaker, and he set the ball rolling. And thereafter, one of our major achievements is this conference, international conference called Synapse. And very recently we had its second edition. It started last year. And it is about mind-body medicine in diabetes and endocrinology, which is a joint venture of Indian Psychiatric Society and ESI, Endocrine Society of India. So the diabetes and endocrinology specialist people. And again, it is perhaps first time in the history of Indian medicine, the medicine in India, that two professional associations have come together and actually formed a joint conference. And it has already become a sort of a very well received conference internationally. There soon is going to be a special issue on a journal called as Frontiers in Diabetes, which is going to come out with a special issue on this topic, mind-body medicine in diabetes. And our friend Dr. Sanjay Kalra, who is the immediate past president of ESI, is going to be the co-editor of this activity.
काय झालं ते उशिरा असतं ना 12
So this, you can say we are really very happy that it has sort of become a benchmark in this particular field and already receiving a lot of international attention. Last few years, couple of years, we have been making a lot of training workshops of professionals. So we held a national workshop at Bangalore for psychiatrists, but it's not just limited to that. We also made many other workshops for the other people. We made many workshops for patients, and which was a very enriching experience to basically demonstrate that patients could be trained, patients and relatives in a group setting, which makes the whole effort very time economical. And there is also a very active Indian contribution to research in this domain. I'm going to tell you in a minute. And as a consequence of these activities and prompted by the international key opinion leaders as well as our Indian Psychiatric Society's national leadership, we are very encouraged, as well as these other associations, to basically formulate and roll out a training course which is going to be international in its scope, and it's in pipeline. We hope that it is rolled out very soon. Nischol is going to tell you more about this course. All of you who are interested, of course, can participate in it. It's an e-course. Next one, please. So to talk about the research contribution,
You're not audible, sir.
sorry, I think I was muted. There is a phenomenal work which was actually initiated by Professor Gangadhar and Professor D. Nagaraj, and now carried forward with great gusto by my colleague Shivram, which is about functional neuroimaging. It's mostly a functional MRI work, as well as a neurochemistry, neuroendocrine work, as well as several clinical trials on various aspects, which is currently going on in NIMANS. And I'm very happy, perhaps you may already know that as a consequence of this work, in the clinical guidelines from UK, it's already included. They already have sort of included yoga as a treatment which is extremely useful for management of schizophrenia, in addition to the pharmacotherapy. And a second group, which is working out of Pune and Munich, works on the autonomic neuroscience, about the autonomic nervous system's role in resilience building. This is the work with which I am also involved. It has been going on for last several years, and it has also generated some fascinating new findings. And there are a lot of trials which are going on in India in cardiology, neurology, and diabetes, some of which we are also associated. And some time back, there was a conclave, Vaibhav Vaishvik Bharatiya Vaidyanik. This was basically organized activity organized by the Prime Minister's office to plan about next 10 years rollout plan for India, which is about integrative health. One country, one system is expected to happen by the year 2030. And we are also very happy and lucky that we have been contributing to the evolving scientific framework of mind-body medicine. So there is a lot of activity, and the good part is that any and everybody who is interested, we are very open. Any and everybody can join into any of these activities as per your own interest and inclination. And there is a scope to join in with the services, with the training, with the research, whatever you like. It's like open thing. It's an open platform, and all of you are invited. Next one, please. A little bit about this course, that the proposed this e-course on mind-body medicine, part of it's all going to be also be available in an e-form. So there is no need for people to be in the same physical space. It can go, any people can join in from anywhere, and it will have a lot of emphasis basically on building the clinical skills through supervised casework, and which is going to be a very unique feature of this course, so that people directly learn, the professionals directly learn to apply it to their patients, and which will be under the guidance of global panel of experts, our collaborators from within Europe and US, which will provide you the opportunity to acquire a very in-depth knowledge and skills to handle different type of cases within this framework. Next one, please. This is my last one. So on Sunday morning, myself and Professor Mohan Agashe, two of us are going to speak in this international conference called International YogaCon USA 2021. And we are going to have an interactive session on adversity and resilience. And all of you can think of joining this. I hope it's going to be a very interesting discussion session. And the director of IIM, Indian Institute of Management, Indore, is the moderator of this session. And Swamiji, who is the Pro Vice Chancellor of the Ramakrishna Ashram Vivekananda University, he is one of the speakers, and Mohan Agashe and I, we all are going to talk about this adversity and resilience. So you are invited. It was my purpose to just to kind of give you this brief presentation about the activities essentially of this forum, the task force together with its national and international collaborators. Nischol and Kalpana are going to make the main presentation, and please be patient with them, because it's a presentation which may take about 40 minutes. I'm in some way very happy that you all said some very good words about us, but also those good words come at a cost of a little bit time. So I hope that you will have a patience enough to be there attentive while Nishtal and Kalpana carry you through this main body of this session. Nishtal and Kalpana, please. Thank you so much.
Thank you, Phadke sir. Now, the next speakers are Dr. Nischol Raval and Dr. Kalpana Raval. So today I have got opportunity to introduce these two esteemed psychiatrists from Pune. So talking about Dr. Nischol Raval, he is a psychiatrist practicing in Pune since more than 10 years. And he is also a convener of IPS task force on mind-body medicine from 2019 till date. He is affiliated to Sahyadri Hospital, Jahangir Hospital, and Center for Behavioral Medicine in Pune. He stood first in his diploma in psychological medicine examination that was conducted in January 1999. He also received distinction in biochemistry in first year of MBBS. He received a letter of appreciation from Government of Maharashtra for work during Gujarat earthquake, the work which he did about the psychological support given to the victims. He conducted several symposia and workshops on mind-body medicine, and he has participated in many clinical trials. Now talking about Dr. Kalpana Raval, she is a consultant psychiatrist working in Pune since so many years. She is a member of IPS task force on mind-body medicine since 2019 till date. Presently, she is associated with Sahyadri Hospital, then Asha Sanstha and Center for Behavioral Medicine in Pune. Her major achievements are, again, she stood first in DPM examination, which was conducted in July 2002. She also conducted several symposia and workshops on mind-body medicine. She has previously participated in many clinical drug trials on schizophrenia, depression, bipolar mood disorder, and various psychiatric disorders. She has been involved in training healthcare professionals who are catering to psychosocial needs of victims of domestic violence. So with this, I invite Dr. Raval, both husband and wife, to start their deliberation. Thank you. Over to Dr. Raval.
Thank you, Sandeep.
Thank you so much.
Yes.
Yes. Yeah. Just to save the bandwidth, we are switching off our video.
Yeah.
And we'll begin with the presentation.
Thank you so much, everybody, for the opportunity that you have given us. And thank Hello?
Yes, ma'am, you are audible, please.
Yeah. I was just thanking everybody for the opportunity and thank you for the kind words. Without further delay, I'll just start with the presentation. Just a sec. Yeah. So like Dr. Sanjay Phadke has already mentioned, mind-body medicine is a very long known concept, and we have seen it in psychosomatic disorders since a very long time. But with emerging scientific evidence, we know that it has application in a lot many more disorders. The notable ones where the application is very, very obvious are diabetes, obesity, depression, endocrine disorders. But as you can see from the list, there are many disorders, and probably I haven't been able to include all of them. Mind-body medicine is unique in a way because it is also useful in improving personal wellness. It's not just helpful in treating the disorders and managing them well, but it is also to improve your own wellness. So let's see the basics of mind-body medicine first. It can be seen on different parameters or different ways. First of all, it talks about health as a whole and that the mind and body are inseparable. We'll speak about all these in detail in sequence. The second one is about health being a dimensional aspect. The third one is about health as an ecosystem where the individual is actively interacting with the environment and so is directly influenced by the environment. Then the health universals, and especially the 5 pillars of health, the physical, psychological activity, nourishment, rest, and variability. And health personalization and regulation by self, and that is probably one of the most important one. So we'll begin with the first, health as a whole, and how the mind and body are actually connected and the biology of it. The mind and body can be sort of seen to be connected through one main axis, and that is called as a psycho-neuro-immuno-endocrinological axis. Now, we all knew that these systems work very closely together. The mind affects the autonomic nervous system, the mind affects the hormonal system, the mind affects the immunological system. But now with the help of growing research, we know that it is not unidirectional, but it is bidirectional or rather multidirectional. All these systems, all these 4 components that I'm talking about, they all can influence each other independently or through the other system. And that is why it is very necessary to look at it as a unit rather than as separate entities. So there have been various milestones in this regard, and I may list a few right now. Probably the first documented research on the connectivity of mind and body was by Walter Cannon when he documented the autonomic nervous system response to stress. And from there began a big journey, which sort of talked about various aspects of how mind influences the body, which can be seen in mainly in 1950s. Hans Sallier, he showed that the cortisol HPA axis was getting affected by stress or getting involved in stress adaptation syndrome, which he very famously put on as general adaptation syndrome. And there was also in 1971 EEG findings in transcendental meditation hypometabolic state. They were documented by Mr. Wallace, and that journey has continued. It has been very intriguing, interesting journey with lots of research possibilities and still a lot unknown in this regard. In clinical settings, we see direct application wise, there have been a lot of studies again, and there have been few milestones which begin with 1910 study where negative emotions were directly shown to be connected with coronary thrombosis. And like Dr. Phadke said, Harvard Medical School and the Cardiological Association, they have been particularly researching this aspect where the outcome of patients who are suffering from cardiac disorders can be modified using psychological techniques or techniques derived from yoga, meditation, and other behavioral aspects. Now, Mr. Viktor Frankl, which we all know, has been a pioneer of positive psychological well-being. He has also shown that psychological well-being is in fact protective, not just sort of helping improve the illness, but it is also protective in a positive way. And again, Martin Seligman, Viktor Frankl, all these positive psychologists, they talk about resilience, about going further than just being healthy. I may mention here an interesting common cold experiment which was done in 1991, and that was published in New England Journal of Medicine, where they chose 400 subjects and they did a controlled study where the test subjects were given intranasal common respiratory viruses. And what they found was very, very interesting, that only those people with higher psychological stress, only those people, they developed infection, and the rest of them, I mean, not all of them developed infection. Our own Dr. Leena Phadke ma'am, she has been experimenting and doing a lot of research in this regard. And in her earlier papers in 1997-98, she had also documented how the immunity gets lowered in animals that were imprisoned. And the guinea pig that you are seeing in this wire mesh, that showed effects of imprisonment on the immune function, which got recovered upon freeing the animal. Again, the recent research shows that increased amygdala activity is probably one of the main generators of several risk factors. For example, negative emotional states, inflammatory reactions, and adiposity factors, which help us build our fatty tissue. And they have been important, again, in our understanding of this whole PNIE axis. Now, in keeping with that, I may cite here another research that I came across recently from the Journal of Epidemiology and Psychiatric Sciences, where they studied individuals who are diagnosed to have immune-mediated inflammatory diseases like irritable bowel syndrome, multiple sclerosis, and rheumatoid arthritis. And what they found was, in the retrospective cohort study that they carried out, there was evidence of increased psychological disorders like depression, anxiety, stress-related disorders, bipolar disorders in the 5 years preceding the diagnosis of these immune-mediated inflammatory disease. So something must be happening in this mind-body connection, which probably later on is getting reflected in autoimmune disorders. Now, in cardiac department or cardiac coronary heart diseases, this has been well established. And as you can see from this picture, this becomes a vicious cycle where depression leads to coronary heart diseases, and coronary heart diseases ultimately lead to depression or negative emotional states. And it is mediated through various channels. I mean, not just one direct approach, but through the hormonal system, through the BDNF channels, through inflammatory systems, the autonomic dysregulation, the endothelial dysfunction, and so on. So to summarize the role of mind in health and illness, basically we have to understand that negative emotions like depression, anxiety, anger, stress, distressed personality like type are important risk factors for illnesses. But as we understand this negative impact, we also have to more attention to positive psychology, optimism, and meaningfulness in life as protective factors. And that is where a very, very important question comes up, that whether I can generate states at will and how can I do that to improve my resilience. So I'll hand talk about aspect.
Taking over from Kalpana. So we see health as a dimensional approach. Yeah? Initially, people had a thought that health was just absence, merely the absence of illness. But building upon it, people started saying that is much more. There is much more to health, and we came up with the concept that it is also a state of social and physiological and physical well-being. But what we now, the concept that we now see coming, health is a dimension which goes from the left of the screen, as you see in this chart, from a resilient system to the extreme right of it being a state where there are disease complications and where the target organs get affected. Most of the clients that we see usually come to us when we see them either in the yellow zone or they have just entered the orange zone. And the stress destabilizes the rhythms or the order of the system and pushes them more towards the disease complication states. Whereas what we have seen that if we use certain mind-body medicine approach, it helps in restabilization of the system, and it helps the system move from the disease state more towards the healthier or the orderly state, and may even help in becoming the system becoming more resilient. So here we come to the concept of what is resilience. Yeah? It is the capacity or the ability to recover from difficulties. Yeah? So, resilience means the ability to adapt to a change without being damaged. It helps in building the goal of newer model of health promotion and in health prevention. So resilience actually helps us to put up newer goal. So not only come back to the original state of health, but also go a step further and build on whatever you've achieved to becoming more resilient to future illness states or future problems or stresses that you may face. This is very beautifully, explained by the concept of antifragility by Nicholas Nassim Taleb in his book on antifragility, where he mentions about converting an adversity into an opportunity. So just like this pandemic has been an adversity to most of us, but for some it has become an opportunity, and they've built upon this adversity and converted it into better opportunities for them, for their businesses, for their health overall. Again, now from this dimension of health, we go on to how the health is connected with different ecosystems around us. And Kalpana will speak a bit on that.
So basically, as individuals, we have a lot of systems running inside us, and we interact actively with our environment. And you can see this health as an ecosystem with macro, micro, cosmic connection. Now, as mainly responsible for this are biorhythms, which reflect the connection of our bodies with our physical environment. And these biorhythms can be of different types. The circadian rhythms, which are 24-hour long. The ultra circadian rhythms are little shorter, and infradian rhythms are probably longer than circadian rhythms, can be like menstrual cycles, which can take up a few days or a month. Our body is also going through various other rhythms and various other phases like catabolic and anabolic phases. We also have rhythms for various hormones which shoot up or which are high at particular times of the day and which sort of have lower values at other times of the day. Mainly important in this aspect is the cortisol rhythm. Then we also have sympathetic and parasympathetic systems sort of becoming stronger one of them becoming stronger and the other one becoming a little dormant. And we also have immune system going through these kind of responses or these kind of rhythms. So basically, to understand the whole body and every cell of it has its own clock, and all these clocks are involved and integrated with each other. They are run by the master clock, which is a suprachiasmatic nucleus in the brain, which sort of looks after the synchronization of it. And that happens through the autonomic nervous system and the hormonal system, which is the HPA axis. We've seen that parasympathetic modulation is increased during night in the healthy volunteers. There is a good dominance of parasympathetic system during the night, and this was proven by Dr. Lina Phadke in one of her studies. And the vagal tone is high, very, very high in these healthy individuals. There is also a clock for immunological system where lymphocytes become very active at one particular time of the day, which is called as the lymph node trafficking and adaptive immune response. And usually as the sun sets, this immune function usually starts becoming more active. Now, the importance of understanding these clocks is that when there is a disruption of this rhythm, then we see the negative impact of it on our health. And there are, in the lab experiments, they see severe consequences of it. In general, in our practices as well, we see that most of the patients have deranged biological rhythms in some way or the other. And as a result, this is actively researched across all specialties, from diabetes to cancer. And they start looking at how these disruptions affect the aetio-pathogenesis and also how that can be helpful in managing these patients better. And one of the, again, emerging sciences is that of chronotherapy, where you decide about the time of giving the medicines, when it will be suited to the patient, and how it will get into the basic biorhythm of that patient. So the timing of the event also determines the outcome, and basically the disturbance of, we have to remember that disturbance of one rhythm is also going to disturb the other cycles as well. Now again, timing of the event, when I say that, there is interesting research that I came across yesterday or day before, in fact, where it has been found that to reduce the lipids or triglycerides in the body, patients are benefited more if they exercise in the evening rather than in the morning. All along we have been told that morning exercise is better, but this particular research goes to show something against it, and it shows that triglycerides reduce well if the person is exercising in the evening. Now, as we understand these biorhythms, we also have to understand a little bit about the psychosocial environment, because the individual is going to interact with the environment, and it is an active bidirectional interaction again. So psychosocial environment plays important role in health and illness, and stress becomes very important in this aspect. Now, there are various life events which one has to remember. They can be negative as well as positive, and both types of stress are equally going to impact the health. Then the stresses can be undesirable, unanticipated, unpredictable, uncontrollable, undisclosed, and so on. And we have to just understand them, categorize them, and help people get out of them. Some of the stresses are going to act like black swan events, where a person cannot be prepared for it, once in a lifetime event, and personal disasters also can be listed in this. Now, as we speak about these rhythms and these interactions, another interaction is happening at the gut level, at the intestinal level. And this is again important component of development, which we cannot overlook. This is a rapidly developing science again, and we are knowing many more interesting things about this brain-gut axis, as it is very commonly called. And initially it used to be thought that the intestines or the digestive system responds to whatever happens in the mind, But now we are coming with some research and some interesting data which shows us that probably gut bacteria are going to affect our brain positively, negatively, and there could be possibilities that gut bacteria can act as one of the therapeutic modalities to improve some of the neurological conditions. So now after this, we talk about the health universals and the 5 pillars of health, and Nischol will elaborate on that.
So thank you, Kalpana. So basically we have understood a few things. One is about health being a dimension, and we have tried to see the different biorhythms around us, the interaction between us and the external and the internal environment that we are having. And the best way to try and influence this is through the 5 pillars of health. So most important and foremost over there is good sleep, rest and relaxation. Now we all know the benefits of a good 6 to 8 hours of quality sleep, and we also know what effect it has if you don't get it. Good physical activity, fitness of around 150 minutes per week, or if there is moderate activity, 75 minutes of fitness activity per week of intense activity. Good nutrition in the form of a balanced diet is essential, but now we want to understand much more into it, much more than only the balanced diet. We want to see the effect of different types of diets. We want to see the effect of different types of fastings that people are doing. For example, the role of intermittent fasting on mental health and on physical health is fast being researched and is coming into mainstream. We also are seeing that good psychological engagement is going to generate a lot of positive emotional state in the form of happiness, satisfaction, meaningfulness, and optimism. And amongst all this is good variability. So with good sleep, good physical activity, good nutrition, good psychological engagement, they were core features which were already being studied for a long time. But over recent years, we are finding that variability is again a very important factor. As you all know, there are rhythmic fluctuations within a range, and this is healthy. Yeah. So our pulse, our BP, our temperature, our respiratory rate, all normal rhythms or functions of our body and mind have a normal range, and these are measurable. Just like there is variation in the nature in the form of daily, monthly, seasonal, or annual variations, similarly, our body also has different variations. So this is very beautifully explained in the book From Clocks to Chaos, The Rhythms of Life by Leon Glass and Michael Mackey, in which he describes the fluctuations which are there within a range, and that health is non-linear and there is a range which is present. This actually goes on to show that the natural state of health is also described as being in dynamic stability. So there is constant change and movement to get final stability. Going on upon variability, there was a lot of pioneer work done by Goldberger on heart rate variability, in which they measured the interbeat differences between each heartbeat, and they found that the more the variation between each heartbeat, the better is the health and the better is the predictability of disease. So the people who had large heart rate variability are less likely to become ill, and if they do become ill, they are likely to have better prognosis. Whereas if you have low heart rate variability, the chances of it almost predicts that you are going to have some ill health. And as we know, heart rate has a very deep connection with the autonomic nervous system. And so heart rate variability also is the key to understand how our ANS or autonomic nervous system is functioning. Because if there is a higher sympathetic tone, then it means that your heart rate variability is going to be low. That is, if there is a higher parasympathetic tone, then your heart rate variability usually is higher. And we know that a higher sympathetic tone as described by Grassi et al. In his neuroadrenergic hypothesis of hypertension, is key to development of a lot of disorders like hypertension, metabolic syndrome, diabetes, and heart disease, and also leads to complication of these diseases. For example, microvascular damage. Therefore, a progressive increase in sympathetic overdrive is very directly correlated to progression of disease from mild to moderate to even severe. And therefore, we know that autonomic dysfunction, that is increased in the sympathetic tone, and at the same time, reduction in the parasympathetic tone is very likely to be correlated with a lot of common underlying mechanism for a lot of other non-communicable disorders. Going a bit more about heart rate variability, and it is very wonderfully shown in this point care chart. On the left hand side, you see the point care chart of a person who has diabetes, whereas on the right, you see the point care chart of the heart rate variability of a person who is healthy. If you see on the left hand side, on the top, the green dots are all clumped together on the upper right quadrant. Whereas if you see on the right hand side, the point care chart of a healthy individual, they are all well set. The points are all well separated. That is the interbeat interval. That is well separated. So if you see the heart rate variability being clumped together as shown in the left hand side chart, shows that there is reduced variability and the person was later on found to have diabetes. Whereas the right hand side shows the heart rate variability of a normal individual, healthy individual. Going on to the next chart. Again, heart rate variability has been very directly correlated with progression of illness as well. So there have been lots of studies which show that for people who are suffering from diabetes, reduction in heart rate variability correlates to a progression or predicts complication of the illness. So if you see from the charts, the first chart on the upper left hand side shows a heart rate variability which is well spread out. Then if you go to the one below it on the left side, it shows a heart rate variability which is gradually decreasing. Then the third chart shows a person who has developed some complications. And then the fourth chart with a very, very reduced heart rate variability has someone who has already developed target organ damage. So with all these advances in neurosciences, understanding of biorhythms, understanding of health as a dimension, understanding of the variability and the 5 pillars of health, we actually come to thinking about how do we get to our health, a good state of health, and how do we go on further from that. One of the key ingredients is to know much more about the mind. Yeah, so we want to stop being full, your mind being completely full of things, to being actually mindful. Yeah, and we learn to be present and enjoy the moment. So I'll talk a bit about the neurosciences which actually influence our understanding. And over here, I want to talk about the experience of self through being mindful. So over here, we are using metacognitive metacognition to understand the inner state of the person. So the techniques that we are using are interoception, that is to perceive the inner sensation in the form of proprioception, various visceral sensations, thermal sensation, and pain sensation. So the individual starts perceiving what is going on inside his body. Yeah, is able to actually not only perceive the 5 major senses, but also able to perceive the state the body is in. So I'm able to understand my temperature, bodily temperature, my bodily movements, my visceral movements, how I am able to regulate my breathing patterns. Second, we go on to introspection, in which the person is able to also assess and become aware of his emotional and cognitive processes that are going on in the form of attention, his thinking, his memory, and his perception and action. It also includes his state of alertness and energy and biological drives. in introspection, there is also a part of reflection. So you're able to reflect on what he is actually experiencing. By having introspection and introspection, we then build on that to have intentional and willful regulation of an inner state through attention regulation, autonomic regulation, and then action. And over here we use contemplation to give direction to his life. So in short, I'll try to give you an example. So what we do, we teach the person to introspect and introspect, and then using whatever the person has learned via introspection and introspection, we use intentional and willful regulation through attention regulation, autonomic regulation, and ask him to act. After he acts, he then has to reassess himself by introspection and introspection, make certain changes, and then act again. Yeah. So over here, this wonderful work by Menon in 2015 shows how we can go from being mindful to being mindful. So this picture basically shows the default mode network that is used when we usually daydream or are just, for example, what a lot of people are doing nowadays. They are surfing the net. Yeah, there is no particular motive. They just surf the net just for the sake of it to pass time. So that's the time when the default mode network is working. This default mode network is not associated with good health. It is usually there is self-referential mental activity or fantasy mode going on. On the other right hand side, you see the central executive network, which is usually active when there is a cognitively demanding mental activity, like you would do when you have a focus and you have to work on that. What is usually needed is what we see in the middle, that is the salience network, which acts as a switch. So it is a network which is between the anterior insula and the anterior cingulate cortex, and this network basically helps us to switch between both these networks, that is between the default mode network and the central executive network. So to solve a problem, usually the salience network is the network which helps. It reduces the default mode network and it increases the activity of the central executive network. So therefore we are able to focus on those particular tasks and be more creative and solve that problem at hand. So, as Kalpana has already mentioned, increased amygdala activity is responsible for a lot of negative emotional, inflammatory and adiposity factors, which are important in understanding our disease process through the PNI. The Rotterdam study found that the practice of meditation and yoga is associated with a smaller right amygdala volume and hence lesser disease risk factors. So coming to all that we have discussed about mind-body medicine, what we need to take home is that when we look at all these things, there needs to be health personalization as well. And one size does not fit all. So just like one shoe size does not fit everyone, one treatment modality may not fit everyone. And therefore, it is important that we train the individuals or our clients or our patients, whosoever you may refer them to as, in assessing and modulating their health by using various different pillars of health that may use. For example, exercise, sleep, nutrition, or positive psychological well-being. Yeah. So we are teaching the clients to personalize their health. Now, this is a very time and cost efficient practice of MBM. Can be used in a pyramid approach, in which initially you teach the patient mind-body assessment. Afterwards, you get him comfortable and have him stabilized using various modalities of therapies, either psychological or medication therapies, or other forms of treatments. Then you put down health goals and use problem solving for him to start, building on the comfort and stabilization that he has achieved, and eventually help him to reach a state of health which then can be further built upon, and he can move towards building more resilience. Now, all well said and done, but there are gaps and challenges in translating this approach into actual clinical behavior. And we need to factor in practice realities. So high patient load and time constraint, lack of proper training and appropriate training, lack of proper team or assistance, and cost factors are going to be the main hindrances to actually putting this into practice. And the only key to this is by training more and more people and building up better and bigger teams. Yeah. So a step approach can at least be started in the beginning in the form of putting in a 3-minute mind-body medicine approach in our routine clinic. So when you assess a patient, you see the patient as a whole, try to assess both his mind and body, and start giving some inputs which would push them toward, inform them about the 5 pillars of health. Yeah? Based on that, after that, you can go on to a more detailed 360-degree mind-body medicine assessment of that individual. And in case needed, he can get referred to various other services or to mind-body medicine services for further help and treatment. So translation of MBM into practice is an opportunity of creating positive psychological experience. It is important that we should be open to this new learning and leadership experience, because as clinicians who are trained in health, we should not be just looking at absence of health, but we should be promoting health as a whole and helping build on that for individual to become more resilient. We ourselves should not be shy of experimenting by using these modalities and help in overcoming. Even if we fail or we don't do well, it may be a learning for us, and we'll only build on this and it will add to our resilience. We need to upskill. It is high time that we just stop, being at the as being backbenchers, and we need to be at the forefront and upskill ourselves and give to our patients what they really want. It is very rewarding to learn MBM, and I speak from my personal experience and from the experience of our colleagues, the patients that we see. They all come back with very, very positive regard for this approach. It reduces the stigma that a lot of psychological treatments have because of the understanding of neurosciences which goes into this form of approach. And please remember, we will all become impactful only if we all collectively take this approach. The proposed e-course on mind-body medicine, with emphasis on building clinical skills through supervised casework under global panel of experts, will provide you an opportunity to acquire in-depth knowledge and skills to handle different types of cases. We are coming up very soon with this. It's going to be a course with national and international faculty. And it is also going to offer a lot of case-based learning and supervised learning. So if you are interested, we would request you to please get in touch with either me, Kalpana, or with Dr. Phadke, and we will put your name on the list of people who are interested and keep you informed as soon as the course is launched. With this in mind, I hope we have been able to share some learnings about mind-body medicine, the emerging science, and how we can integrate the latest advances in neuroscience to building up on our skills and offer our patients the chance to become more resilient. Thanking you.
Thank you, Nischol and Kalpana. I thank Dr. Sanjay for giving the overview of mind-body medicine. So also, I thank Kalpana and Nischol Raval for their lucid presentation. They talked about PNEI axis, the changing concept of health, the 5 pillars of health, and how mind-body medicine approaches can help us to have a satisfactory life, healthy life. So thank you very much for lucid presentation, as I said. And I declare that this session is open for discussion, questions and answers.
Madam,
One can read the questions in
Madam, you're mute.
the box.
Madam, please unmute. Madam. Yes, madam.
Okay, sir. Dr. Santosh Chaturvedi is asking, what is the role of cortisol on depression? Whether controlling stress has any impact on serotonin level? Dr. Nischol or Dr. Phadke, sir?
Sir?
Should I repeat the question? Am I audible, Anirban?
Yeah. Yes, madam, you're
Yes,
on.
ma'am, you are very much audible.
Shall I answer that?
Yeah. The role of cortisol on depression and whether controlling stress will have any impact on the serotonin level.
Yes, absolutely. I think it's a very important thing and a very important question that you have asked. See, first of all, we all know that prolonged or chronic stress has lots of effect through the PNI system. Yeah, and one of the major key roles that cortisol plays is to actually cause much more, adaptation process initially. But over a prolonged period of time, cortisol itself is going to have its own problems. So it may be in the form of hippocampal sclerosis. It may be a reduction in the neurotransmitter level, especially serotonin. And this eventually is going to lead to depressive states, negative cognitions, memory difficulties, cognitive difficulties. So if you are going to use stress relieving or resilience building measures, it is going to have a good impact on reducing your cortisol levels and is going to help you achieve better health states.
Can I also pitch in?
Yes, sir.
Okay, thank you. I think Professor Shivram, he was here. I think maybe he might have left. This is one of the very interesting, actually, batch of research, which came out from Nemans when I mentioned neurochemistry, is with regards to depression, cortisol, and another chemical called BDNF. If you may know, BDNF is brain-derived neurotropic factor. So cortisol, as we all know, is a stress-responsive hormone. And BDNF chemical is like a fertilizer in the brain, is responsible for new brain growth. So you can say that they have in some very crude sense, have opposing action. Cortisol works to make the brain thin and weak, and the BDNF works to make the brain stronger. And but this was one of the very interesting things which they did. So they ran some clinical trials in patients of depression who were depressed, and they demonstrated that these depression patients, they had a high cortisol and low BDNF. And with the application of these interventions, predominantly the yoga-based interventions, it was demonstrated that the cortisol normalizes, so the cortisol which had become up in the course of depression comes down, and the BDNF also normalizes. So the BDNF which has become low and the cortisol which has become high in the course of depression, it can actually very efficiently be reversed. And the BDNF, by the way, is also responsible for neuroplasticity, so growing actually the brain connections. And this was a very interesting, you can say, set of studies, couple of studies from our colleagues in Nemans and Shivram's team. A very direct demonstration. And in continuation with that, let me also tell you that another set of interesting studies about the oxytocin. Even in the schizophrenia patients, we know that they become like very withdrawn and cut off from other people. Schizophrenia is characterized by withdrawal from the surroundings and the people around. And it was demonstrated that these interventions, they lead to oxytocin levels building up. Oxytocin, is a hormone which is associated with improved socialization, improved bonding. So if it could happen, in kind of extreme situations like schizophrenia and severe depression, it of course, and that's why it is beneficial, as Nischol very rightly said, in terms of personal wellness as well. We can try it out ourselves, because we know that as we grow older, it's not only in depression, as we grow older, even the process of aging makes our brain thinner. We all need BDNF, we all need a healthy dose of BDNF all the while throughout our lives. You don't necessarily have to be depressed, to be generating BDNF. You want to generate BDNF, don't need to kind of take a dose externally. You can stimulate your BDNF generating neurons through these modalities. And therefore it is very interesting, this whole emerging neuroscience, the emerging neurochemistry, that as we understand the basis for some of these disorders. In a way, therefore, we can say that, once upon a time, there was a term called as a biological psychiatry or biological psychology. It is completely redundant now. We know that the entire psychology and entire psychiatry has a biological basis. There is nothing really without a substrate to it. And the good part to see to it is that we are able to generate nowadays both this type of evidence. So there is a laboratory evidence of success of these interventions, and there is also clinical. So clinical trials show there is a benefit, and at the same, it is paralleled by enhancement in these lab parameters also, like I said, cortisol or BDNF or oxytocin, like that. Thank you so much.
Yeah. Thank you. That was a very interesting experiments that Dr. Phadke mentioned. And we should all start towards improving our BDNF levels, I'm sure, sir. So we'll go on to the next. Dr. Shravan asks, if in our ancient system, many holy people can connect far distant people with the power of their mind, how we can describe this with the modern science? Is it a signal transduction? Dr. Phadke, sir, or Dr.
Yes, I can take this question.
Yes, yes, sir.
So to this, my learned colleague, let me remind that we are talking here about the ordinary mortals like us. So maybe if he's interested, we could discuss, about telepathy and other thing in a personal way. Okay. So here we are firstly interested, to talk about the ordinary mortals that we all are, and we are interested basically to look at simple difficulties in life, kind of more than the esoteric powers. This was also, one of the difficulties in this field, that initially, as you may know, that people thought that whether some people looked at, yoga, meditation, these practices either in a spiritual way or in some sort of esoteric way. And for a long time, there was which sort of kept many people away, from trying out these domains, because people did not think that some of these practices were for them, And now we know that there is also a very practical side to this. So of course, you can have a spiritual or a paramarthic side to yoga and meditation, but at the same, you also have a vyavharik side to it, which we can possibly make use of in our daily lives to enrich our lives. And as Nischol said, there are clear defined targets now in neuroscience term, so we can improve, we can regulate our attention better, we can regulate our autonomic nervous system better, we can regulate our actions better. Thereby, effectively, we can regulate, our external behavior as well as our internal systems in a better way. It needs a kind of a little bit of a regulatory inputs. And this is the crux of this whole thing, so that we get in touch with ourselves, we learn that art, that how we can get a good feedback. There is already such a rich, you can say, sensors. Our body is gifted with billions of sensors, and the data often is wasted because we are not aware of it. We are being fed, as just like Nischol mentioned, very recent research, that whenever we are eating on a moment-to-moment basis, the food content and its value, satiety, it all relate to the brain. So whatever we are eating, even on a millisecond scale, it is related to the brain. The difficulty is that very often this entire data is discarded. We have the sensors are capturing all that is going on in our body, in our mind and in our body, all that is going on. Its sensors are capturing that, but we somehow tend to kind of not really take it into, our cognizance or our conscious awareness. So the idea is that if we are just able to help ourselves get this feedback from ourselves. And it's the best way of personalization. You know who knows your body and your mind better than you. So if we are able to do that, it complements actually the external assessments. So it's like you can say a team of a clinician and a patient. If they work together, there's a whole better possibility for a better outcome and a better quality life. So it's like preventing the current wastage that we have. And in that sense, it's not only about doing, it's not just about exercising. A lot of people, as you know, they do even yoga and meditation also like exercise, so the whole idea is about more awareness, so that you are getting this rich feedback from your bodies and your mind, and then you are working on that feedback, to make it better. If you think it's already good, wonderful. If you think it needs a modification, you can modify that. That is the whole kind of idea in a way. So it's a learnable activity, trainable activity. We know that even in the conventional psychotherapies, people once upon a time were a bit passive, so the therapists used to play a more active role. You can say that mind-body medicine is also a way of self-therapy, where the person becomes he learns and then he becomes one's own therapist, like that. So you can look at it possibly this way.
Yeah.
Thank you.
Thank you, sir. Thank you, sir. So you just reinforced and very well elaborated the intricate relationship between the mind and the body, and what we can help ourselves to do for our body, of course. Dr. D. Nath
Madam,
asks.
Dr. Nischol sir want to have one.
I was just checking the chat box, and there are a couple of questions which I thought are very important for us to clarify. One being, is it, what is MBM? Is it Ramdev Baba's yoga? Yes, so I think it is very important for people to know what or whether it is mindfulness. Yeah, whether MBM is mindfulness. So I think it is people to know what MBM is not. Yeah, we have spoken a lot about what MBM is, but for us to define what it actually it is, I think we also need to define what it is not. And it is not only Ramdev Baba yoga, it is not mindfulness, it is not only exercise, it is not only nutrition. Yeah, so it's not. So I think it would be great disservice to the approach if we just again start looking at one of those things and say that this is mind-body medicine. Yeah, and of course we don't want to be associated with any person over here, either Ramdev Baba or any other school of thought about yoga as well. We are trying to look at the neurosciences and the neuroscientific basis of health and health promotion, because we basically are trained as doctors and in the field of science. So we are using the understanding and the advances of neuroscience and how it influences health by using various treatment modalities and treatment approaches. So over here, what we are trying to do, we are trying to form a new approach to looking at a person and his health, and how to use certain different factors or tools in the form of exercise, nutrition, sleep regulation, attention concentration regulation, using his cognitive processes, and how we use all these to help the patient learn those skills in which he can slowly and gradually start making changes for himself or herself.
Thank you, Nischol, for clarifying that. And let me also add half a sentence. So therefore, more technically, it's or more apt to say that the mind-body practices are really derived, from yoga and meditation. They are not, kind of a yoga and meditation in its pure sense. They are the practices which are sort of based upon yoga and meditation or derived from yoga and meditation. Again, based upon their neuroscience understanding of those practices. And to my mind, therefore, as when Nischol said, that one shoe doesn't fit all. It is therefore unimportant if a person who is applying this particular approach, whether he does specifically A method or B method or C method, the results are important. Whatever is able to give you some more meaningfulness, some more satisfaction, a better attention control, better autonomic regulation. So everybody who is doing a mind-body medicine is not really required, to sign up necessarily for yoga or necessarily for meditation or necessarily for exercise or necessarily for creative art therapy. These are all the, you can say, like different medicines. We have a whole set of antidepressants. And our idea is to make the best treatment matching to the person, isn't it? That we have a whole different set of medicines exactly available for this purpose. So this, therefore, approach makes it different than those other approaches, wherein the medicine is sort of made important. Here the patient is important. The patient and his need and his own recognition that what helps that person the best is most important. If you think that actually 15 minutes slow nice walk is most relaxing to a patient, that's it. You don't need to impose the patient is taught that what gives his or her kind of a maximization of comfort and stability, what gives him or her a better resilience. Patient has to learn that, and therefore trial and error should be encouraged. Person should try out different things. Person should try out jogging, person should try out running, person should try out walking, person should try out mindfulness, person should try out everything. Like we try out different dishes. We go to restaurant to eat, we try out different dishes. We like some dishes, we don't like some dishes. You think something is benefiting you, you adopt to that. Keep doing it. That's the best way of kind of experimenting oneself and going about it. That is the main spirit, I would say, of this science of mind body medicine. Not just something person being put into some specific structure, but person being given the freedom to sort of experiment with oneself and choose what is best for oneself. Thank you so much.
Yes, sir.
Thank you, sir.
Yes, sir. Thank you. Thank you so much, sir. Patient choice should come. It should be on the foremost importance. For the current scenario, there is a question. Dr. Kalpana, madam, can take it up. With this COVID confinement and isolation and the lockdown, we all know that people are missing their social environment and the psychosocial developmental factors around. So will this all worsen? This COVID confinement will worsen our health or mental health? And what is the solution?
Well, it is definitely stressful for a lot of people that we see around. But again, here the individuality comes and how prepared you are. See, in life there are going to be some stressors which are going to be familiar, some which are going to be unfamiliar. But like Nischol talked about resilience, and he mentioned about a concept called as antifragility. We all need to develop resilience for moments like this, or we all need to understand anti-fragility probably for events like this in life. And that is what we are talking through mind body medicine. It is not just today I've had injury and I'm applying some lotion or I'm taking some medicines for it and that's done. I'm preventing injuries, or I am doing something actively so that I can avoid injuries. And that is the whole concept of this mind body medicine, that from being just healthy, we are going a little left towards resilience, towards anti-fragility. Now, in this COVID scenario also, ma'am, you must have seen that, like I said, a lot of people struggled with the social isolation, with the confinement. But some people have just flourished, and some people have found their own talents. Some people have found innovative ways in which they could cope up with these scenarios. And in my knowledge, they range from the small children to elderlies. Giving example which is right there in front of my eyes, my own mother-in-law, she has started learning keyboard at the age of 70 from a teacher who's 73, and they are having online classes now. Where does this social, she hasn't stepped out of the house for almost a year. She hasn't met her friends, her kitty party friends, her routine social circle for almost a year, and she is still happy. I mean, how do we define that, or how do we see that? And the only reason that helps at such times is how your mind sort of deals with these stressors outside, how it perceives and how it adapts to it. So the mind body medicine again talks about bouncing back and these are some of the techniques that all of us should be learning, and that is why we said that this is not meant for just patients. Nischol in his one of the last few slides said that this is for personal enrichment as well, and that helps a lot. I mean, we've done that for now many years, and we know what difference it made to our lives. And similarly, we see that getting reflected in our patients and clients' lives as well. So with what people need to remember now with this COVID situation, that we don't know when it is going to end, but what can we do best to deal with it? What can we do best to deal with the stress? Find new techniques. If one thing hasn't sort of helped, like sir said, it is necessary to go through the trial and error process. If making video calls to friends hasn't helped, then start learning a new skill. If that hasn't helped, start interacting with probably your own household members, or you can start taking up new types of exercises. Where people used to go outside for jogs, they can start with the home workouts. Anything and everything they can sort of try and see the difference that it makes to themselves. And again, this approach is the mind body approach, and that innovation is necessary, so that the stress remains at bay, and this depression, anxiety, social isolation, and all that people talk of does not touch you at all.
Yeah, thank you.
I'll just add on that. So basically what again we are saying is we help the people to assess themselves. So we teach them how to assess themselves, how to understand themselves by using certain skill sets. Based on that, we teach them certain skills which they can use which will help them to improve their health. Now, along with this knowledge, which we have got from neurosciences, we can teach them these things and teach them how helpful that can be. And then the people can start using them on a daily basis and trying them out. So it is not about it's not about me prescribing something. Yeah, it's about helping the person learn about health and help him to walk that path.
Yes. So thank you, Nischol. So here we will be re-emphasizing with the patient the 5 pillars of health that you have mentioned, and giving him the choice of what he wants to do and act positively on that note. Thank you.
At its basic, that is what we would do in the 3-minute mind-body medicine approach. Whereas if you want to build on that, then there are different steps, more
other skills.
Yes, yes. Thank you. Dr. Kendre sir has given a remark that this is a very interesting topic. It is a need of the hour for the whole world. Great work, Dr. Marwai sir, Phadke sir, and Raval and team. And we should have tool biomarker to measure resilience. Do we have that? And he also asked whether there is a particular word in Marathi for resilience.
So, sir can talk about the biomarkers. So one of the key things that we use on a daily basis, which help us show about your resilience, which we mentioned, is the heart rate variability. So we are already using that in our clinical practice. Me, Kalpana, Phadke sir, and it will be surprising for you all to know, but a lot of cardiologists, a lot of endocrinologists, sexual therapists have started using this, urologists are using it. So a lot of different specialties are using heart rate variability as one of the key markers for health. So if you have got good heart rate variability, it has good correlation with better resilience building. And sir, my pitching about BDNF and other biomarkers as well.
Yeah, sorry, I think in my absence you were asking. Yeah. So the good part here is that resilience, you can say there are 2 types, as Nischol said. Clinicians are greatly benefited by non-invasive markers, because which means that you can use them actually in your clinical practice. This heart rate variability is a very simple non-invasive technique. The signal is essentially derived from ECG, same like a Holter monitoring for 10 minutes. So you derive that signal, there is a mathematical processing on it, and you understand it, so you understand about the sympathetic and parasympathetic modulation, and which is of great help actually to a clinician. So it's like a bedside test, which can easily be done. It's a bedside test of autonomic nervous system, and which is one of the, you can say, best markers for use in daily clinical practice. It tells us, about not only the state of resilience, but the allostatic load which Nischol mentioned, the system which is under stress, which is experiencing stress, as well as a system which is now gone in a disease state or a complication stage. And there is a great overlap between body and mind disorders in this, because Nischol, you may be wondering, why did he show some of those diabetes examples? But it's the same for depression also, so whether it's depression and diabetes, it's the same with regards to the autonomic nervous system, because as we showed, the common underlying mechanism, autonomic dysfunction is a common underlying mechanism for all the mind body disorders. So I would say that in fact,
most NCDs, most NCDs.
Yes. So all the NCDs, so all the NCDs, it's and in fact is perhaps going to be a part of this course, to also familiarize the people, those who want to enroll for that course, the clinicians, that how to make use of this simple non-invasive marker, which as I said, is like doing an ECG in a clinic. It just takes, that much effort to do this particular bedside test.
Yes, sir. Thank you. Knowing all these various aspects, I think PPA would want to hold a workshop for at least psychiatrists.
Sure.
So Dr. Nischol and Dr. Kalpana and Dr. Phadke, sir.
Yes.
We will keep that in pipeline.
So this was a great, actually, your initiative that day. Balek madam called me, so it was really wonderful, to hear from our own PPA. And of course, so for PPA, any day, it's a possibility. COVID has certainly put a little bit stop. Before that, we were doing, because the actual physical workshops, itself actually is a good fun activity. And perhaps from some of this heavy theory part, one may think whether one is trying to introduce, another complicated psychological or other physical intervention, but it's not so. Once someone learns it, it's a relatively simple sort of a learnable paradigm, simple sort of learnable and a very enjoyable activity, which kind of ensures, as Nischol said, good quality of life. You can sort of Nischol's fitness, Kalpana's fitness, and to some extent, perhaps, my own fitness, our family members. You can say we are the first beneficiaries, of application of it to our own selves and our beneficiaries. Therefore, we can testify, firsthand, you can say testimony about its kind of a utility, that it definitely brings, more quality and joy to personal lives. So we would be very happy to make it workshop. By the way, this year's focus is on the medical residents, because in the COVID times, medical residents, they really faced a lot of stress situation, whether psychiatry residents, surgical residents, other medical residents. So we are going to, in the month of November, situation permitting, we are going to hold a national workshop, most probably in Bangalore, basically for psychiatry residents. So if you have any students, you can encourage them. And of course, for PPA, we can always make a one-day workshop. One-day workshop is normally good enough, to kind of pick up all this stuff, which otherwise seems more complicated. Actually, in a presentation, is much simpler in practice. And that's why I said that it is scalable. It can actually go to large number of people in a kind of a real easy way, possibly much more actually easier than some of the formal psychotherapies. Okay.
Yes, sir.
So thank you.
Thank you.
Thank you so much.
Thank you, sir. That was inspiring, and seeing you three, definitely more people will be motivated. Sir, Colonel Jyoti Prakash has raised a question. Regular exercises gives good impact on the brain. Yes. So what part of the brain and what action actually is enhanced, and how is it enhanced?
Nischol.
Sir, again, see, as Madam knows, Bhale sir, I think, has been, a person who has been a good proponent of exercise. And I have been also a beneficiary of exercise for a while. So I still do it. Not as much as before, because now I know how much to do and, what not to do and what to do. See, I think the major important factor that exercise has is it increases parasympathetic tone. Yeah, that is one of the key immediate modulators, which you can see with reduction in heart rate, increase in heart rate variability, reduction in heart rate, reduction in blood pressure. So key autonomic activities in increasing your parasympathetic tone. But along with that, what Dr. Phadke mentioned, BDNF is the major contributor for brain growth, brain health. And with exercise, good exercise, the one which is appropriate for you, there are healthy levels of BDNF seen, and which helps in cognitive growth, more good positive state and positive well-being. So I think autonomic regulation and BDNF are the true main processes. Along with that, see, what they've also found is that if you are, there have been various studies that if you are exercising on your own versus you are exercising in a group with people, yeah. So me and Kalpana exercise together. We've never exercised separately. So because I know that there are much more positive effects if you exercise together with people, you are more likely to do it for a longer period of time, more consistently.
For the brain health or mental health, they've found that exercising in a group or exercising with a partner is usually more helpful and than exercising alone.
But again, important is kitna exercise, kaun sa exercise, and over here, see, mind-body medicine helps you to understand that. Yeah, so it helps you to assess, try out things, reassess, again try out different things. Yeah, rather than just saying you do this much exercise, which is the norm, isn't it, for all of us, or do this form of exercise, don't do this form of exercise. It actually is much more important for us to teach individuals to look at key parameters where they should assess themselves and then do a particular type of therapy intervention.
And as Nischol actually mentioned, in his presentation, this variability principle is very important in exercise also.
Yeah.
Body does not really like sameness. Body likes actually some change. So some variability is better perceived by the body. And Nischol and Kalpana all the time, they keep coming up with these nice ideas. Maybe we can do it actually with PPA. Their basic hypothesis is, to test you can say the hypothesis that the husband and wife who exercise together, do they fight less or more? So we can, I think, perhaps with the help of PPA, we can, make this small little nice study to study the social psychology, of husbands and wives, those who exercise together. Do they have a quieter, peaceful, joyful home?
So no, I would go.
The people who don't do that.
There was a saying: a family which eats together stays together. I would go on to say a family which exercises together also stays together.
Yes.
More likely to stay together.
Yeah. Thank you. A very interesting discussion came up. And I thank you, Nischol, for bringing up Dr. Bahale's this thing. He actually gave his, he would like you all to consider him if you want to make a study on exercise-based and yoga-based comparative MBM. Yeah. So he'll definitely pitch in because he has been working for 20 years in cardiac rehabilitation with exercise rehab.
Also there, is he also attending, by the way? Is he also there?
He is at my side, yes, sir.
Okay, wonderful. So he's also listening to the whole.
Yes, definitely, sir. Definitely.
Wonderful. Welcome to him.
Yeah. Yes.
Welcome him. As I said in the beginning, that we already have started joining hands, say like we joined hands with the diabetology people in a very formal way, association to association level. So we are going to do that, kind of very soon.
Yes, sir.
All other people. So like you can say diabetology people were our first partners. Now it will expand to cardiology, expand to gastroenterology,
surgical fields have shown interest.
Yes, because Nischol, like he said on his last slide, that we will be effective only if we do it together. So few individuals practicing mind-body medicine is unlikely to be impactful in society. More people practice it, the more the better, So we absolutely are very, you can say, open, and we really look forward to have more and more partners, who can contribute to this.
Yes, sir. Yes, sir. He will be most happy to collaborate with you. Thank you, sir. Kalpana, there is a compliment to you and Nischol from Smita, that for a wonderful Jugalbandi, that a very enriching Jugalbandi that took place. I think she should witness your jugalbandi during the exercise session also. Yeah, we have received compliments for a wonderful presentation by Dr. Raval, sir and madam. Insightful from Dr. Rahul Bagle. And thanks to the organizing team for this organizing this webinar. Yeah, I think we have done with the questions. I will hand over to Dr. Marwale, sir. Sir, please give your chair's expert opinion and also the take-home messages for all our participants.
What should I talk about before the experts themselves? Basically, it was an interesting session. Even the question answer session was also interesting. So I thank you all. I mean, PPA, IPS Pune, and the IPS task force of task force of mind body medicine, and Mahesh Appar and his team. I thank you all for giving me this honor, and I hand over this mic to the organizers. Thank you.
Marwal is actually our patron saint. None of this. Marwal is a very quiet fellow, but none of this would really be possible, without his initiative. So, in his own quietness, he is a big contributor to this whole thing.
Definitely, sir. Thank you. Thank you, the whole team. Thank you, Dr. Marwale, sir. Thank you.
Welcome.
Welcome. Yes, handing over to Dr. Sandeep. Sandeep, please unmute.
Yeah, it was a wonderful session on mind body medicine, and I would like to thank first of all Dr. Arun Marwale for accepting our invitation to be as a chairperson, and I would also like to thank Dr. Phadke sir, Dr. Nischol Raval and Dr. Kalpana Raval for a wonderful and brainstorming session on this upcoming science called mind-body medicine. And I congratulate them for taking this science one notch above, by being a part of IPS task force in mind-body medicine. So I thank all of them to accept this invitation and to give this wonderful elaboration. And I'm looking forward to join a workshop that will be conducted soon. And I urge all audiences to, join this workshop. And I'm sure that will benefit all of them. For them personally and those who are doctors, their patients as well. So I urge all of them to join this workshop on mind, body, and body medicine. Lastly, I must thank Centaur team for their tireless efforts in organizing these webinars, and they are with us, PPA, throughout since the start of this year. So I cannot thank them enough for being technical support of in conducting this kind of workshops. So with this, to Shruti. So over to Shruti.
So first of all, I would like to thank IPS Pune branch and PPA for once again showing your faith in us and giving us this opportunity to host such huge stalwarts of psychiatry world. Special thanks to Dr. Mahamuni sir, as always, sir is with us. Special thanks to Dr. Bhale madam, she is a ray of hope and sunshine. And special thanks to Dr. Marwale sir for chairing today's session. It was a wonderful session. Thank you to our speakers, Dr. Phadke sir, Dr. Nischol Raval sir, and Dr. Kalpana Raval madam. It was a really lucid and beautiful presentation by Dr. Phadke sir, and the most beautiful and synced couple I have ever seen, I guess. Dr. Raval. So the total team was amazing. And I would like to thank all the participants and including the medical fraternity for gracing us with your presence today. I hope you got lots of learnings from today's session and it will be useful for you in your future endeavors as well. Our team at Centaur Pharma will always be your trusted scientific partner and keep bringing such beautiful educational programs in future too. And we feel very loved, honored, and supported seeing you being present here. And we hope that we keep continuing our relationship and bond just like this. So once again, I thank everyone for today's session. And this is Shruti Shettigar from marketing team of Centaur Pharmaceuticals signing off for tonight. So take care and take care of your loved ones. Stay safe because you mean a lot to us, sir and ma'am. So good night.
Good night. Thank you.
Thank you. Good night, sir. Good night, madam.
Good night.